Hello and welcome. I am the MA mentor, and today I am going to go over how to remove sutures. This is a task that many MAs do on a regular basis. So let's just jump right in and look and see what we will need. We will need a 4x4 gauze, some exam gloves, forceps, and scissors. Now, many of your clinics will probably have suture removal kits that come in a pre-made box, so to speak, that is sealed up, it's sterile, and it has all of the various components in it. Some will just have the instruments. Others may have the instruments and the gloves and everything else. Okay, so let's take a look at what we need to do. Okay, so this is our fake patient with their sutures. Okay, and as you can see right here, we have sutures already placed. Okay, so what we'll do now is, the first thing we want to do is just take a generalized look at them to make sure that everything looks okay. Is there extra scabbing? Is there pus? Is there inflammation? Is there redness? In that case, we would want to check with the provider just to make sure that it's okay that they come out. Okay. Sutures are usually removed in 7 to 10 days after they are placed. So right here we see they're fine, they look great, they look like they're ready to come out. So we're going to go ahead, we'll wash our hands. We will apply our gloves because we want everything to be clean. Okay. And then we're going to go ahead and take a look at how many sutures there are. Now, if your clinic is the one that put the sutures in, you will have a record of this and you'll be able to see documentation of how many were put in. If the patient came from, say the ER or somewhere like that, and you were not the ones that put them in, then they generally may not have access to that documentation. But we can see right here that we've got 1, 2, 3, 4 sutures, okay? And that's important because once you get them out, you want to make sure you have the same amount out as were in, if that makes sense, which is why we have our 4x4 gauze here. Now, if there was some extra scabbing or anything like that, you obviously don't want to just pull scabs off of the skin. In that instance, you can use a little trick where you take another 4x4 gauze and go ahead and soak it in some saline solution, and then you could just lay it over top to kind of soften those scabs up. Maybe go room another patient, give it 5-10 minutes, and then come back, and then you can gently remove those. Otherwise, we use this to place our removed sutures on so we can count them after they're out. Okay, so now I'm going to take my forceps and my scissors. And what I want to do at this point is use the forceps. Unfortunately, these are approximating forceps with the teeth. I generally don't like to use these. Unfortunately, this is what I have. But I just want to very gently grab the knot of the suture, slide my scissors underneath, cut it, and pull it out. And then I'm going to go ahead and put that there. We're going to repeat that. You grab the knot, pull up gently, slide your scissors underneath, and pull that out. Now, if you notice, I left a little of this one, so we're going to grab that just gently and pull the rest of it out, maybe with my fingers. Okay. You don't want to leave suture material in the skin. There we go. Got it. Because what can happen is the skin can then grow over it and it could cause an infection. Okay, next one. Grab the knot, slide the scissors under, snip, pull that out, and then last but not least, Slide the scissors under, snip, pull that out. Okay. Now we want to go ahead and take a look. Now this is obviously skin that's used for demonstration, so the incision has opened back up. But the skin on a person should be nice and healed underneath. Some offices, and go by the protocols in your office, may want to put a little bit of maybe Neosporin on there and kind of put a bandage over it if it's looking, you know, not so happy. Otherwise, you can just leave it. I would clean it up with some saline solution. But then what we're going to do is we're going to take a look at our 4x4 gauze. And as you notice, we counted 4 to begin with. We now have, and I count by the knots, 1, 2, 3, 4 knots. And that means we got all of them out and we are completed. We'll let the doctor know. Take our gloves off, wash our hands, dispose of everything, and that is a completed procedure. Okay, so now we're done. We have removed the sutures and we are ready to go on about our day. Thank you so much for watching. And if you enjoy my videos, please drop a like and subscribe to my channel. It really goes a long way, means a lot to me, and helps me to continue to make these videos. Thank you so much, and we'll see you next time.